Hello everyone! Thank you for taking the time out of your day to watch my video. My name is Annamaria George and I'm a high school student from New Jersey. Today, we will be looking into using over-the-counter medication and examining exactly how useful they are when fighting against pain. I hope that you can learn more about each method in order to find out what works best for your body. So, let's find the right cure. We all know the moment. It's Friday morning, and you wake up from a good night's sleep, hoping for a good day. The sun has risen, the rooster has crowed, and you can smell the aroma of the delicious pancakes downstairs. You get up and yawn until you find a sharp pain in your head, and it's over. The beautiful day you thought would happen just turned mellow. You go down to the kitchen as you don't know what to do with this annoying migraine. Do you take Tylenol? Do you get a massage? Do you put a damp towel, hoping to wait it out? Well, that is what we are here to learn more about. Pain is annoying to deal with, but it is necessary, as it allows the person to understand what their body might be going through. Without it, you would not know if your body is working properly or not. Considering this, pain can interfere with our daily life and cause us distress. Over-the-counter painkillers are easy to get access to, and it's even easier to decide to take them. But they have unforeseen complications in case you don't know how to use them properly. Therefore, it's important to know alternative treatments in order to avoid risking this problem in the future. Over-the-counter medication is a class of drugs which you can get at pharmacies without a doctor's prescription. There are usually two subdivisions associated with relieving pain. There's NSAIDs, non-steroidal anti-inflammatory drugs, and acetaminophen. First, we have NSAIDs. Some common NSAIDs are ibuprofen, aspirin, naproxen, indomethacin, meloxicam, and celoxicab. NSAIDs are very popular among adults and are accessible for most people. About 30 million people use NSAIDs every day. NSAIDs treat headaches, fevers, common cold, backaches, dental pain, premenstrual syndrome, muscle aches, and injuries, and inflammation in the joints, bone, and bursae. They're able to do this by preventing specific substances in the body that can cause inflammation or inflammatory mediators. There are some risks, however, with NSAIDs that can't be overlooked. NSAIDs can cause a plethora of skin reactions, such as hives, swelling, and rashes. NSAIDs, besides aspirin, do increase the chance of heart attack and stroke, even in patients who did not have a history of cardiovascular disease before. NSAIDs also increase the chance of gastrointestinal bleeding as they block enzymes that can cause pain, such as COX-1 and 2 enzymes. The enzymes protect the stomach lining. By blocking this enzyme, NSAIDs can lead to a higher risk of abdominal pain, heartburn, nausea, and diarrhea. This lack of protection for the stomach's lining leads to a dangerous side effect of inner bleeding and ulcers to develop. Ulcers are sores that develop on the lining of the stomach that can be caused by bacterial infections or long-time use of NSAIDs. Besides these, NSAIDs for chronic pain and being exposed to these effects for a long time can lead to unwanted, disastrous new conditions. Using these NSAIDs for chronic pain and being exposed to these effects for a long time can lead to unwanted, disastrous new conditions to develop. According to a case study by Liu, Sverden, Jung, and more researchers, NSAIDs, along with proton pump inhibitors, which are medicine used to reduce stomach acid production, was found to be closely associated with bleeding from peptic ulcers. Although the sales of NSAIDs are decreasing, the bleeding side effects that come with them remain at a constant rate. The numbers in regards to complications decrease only when the sales of NSAIDs decrease, showing a direct relationship between NSAIDs and disastrous side effects. Along with that, the amount of people who die from bleeding complications are closely tied with the number of sales being made. 11 out of 100 men who take NSAIDs on a daily basis died from peptic ulcers. In women, 12 out of 100. Let's move on to the next class of painkillers, acetaminophen, also known as paracetamol. There are two brand names that come to mind with acetaminophen, Actamin and Tylenol. However, there are countless medicines, both over-the-counter and prescription, that have acetaminophen. More than 600 of these medications have the active ingredient of acetaminophen. Acetaminophen is the most commonly used painkiller in the U.S. It treats headaches, muscle aches, arthritis, backaches, toothaches, colds, and fevers. It is also considered relatively safe for patients with cardiovascular disease, as it is safe for those who have hypertension. Also, Tylenol does not have a huge risk for gastrointestinal or kidney problems. One thing that is unique with acetaminophen is that it can be used in conjunction with most NSAIDs. Using two sources of NSAIDs can cause an overflow of side effects, but people can use NSAIDs and acetaminophen to target pain relief with higher intensities. Although acetaminophen has benefits, there are some risks. Acetaminophen does have an efficient way in reducing pain, but it also reduces empathy. There's a psychological difference as long-term use can also decrease the emotions that one feels and prevents them from fully empathizing with others. Also, acetaminophen comes with a higher risk of overdose. About 980 people die due to complications from acetaminophen use, and over 300 die from acetaminophen overdose annually in the United States. This higher risk of overdose, the more chances that you can experience liver damage. Also, taking acetaminophen in conjunction with consuming alcohol can send an overload of substances to the liver, causing it to fail. The recommended maximum daily limit is 4,000 milligrams, which is 8 extra strength Tylenol, but over 7,000 milligrams per day is enough to cause serious overdose. Acetaminophen is said to have a high risk of interfering with proper brain functioning. Acetaminophen interferes with the ability of finding mistakes as it dulls concentration and loses cognitive control in daily life. Although painkillers can relieve pain from headaches, it can have a dangerous effect in the future after long-term exposure. If you take them more than what is needed, it can trigger headaches that can come back at a higher intensity. If you have a chronic headache disorder, it is important that you seek treatment that is specialized in treating headaches. By taking painkillers that have a general target focus, you can cause your disorder to flare up. The common symptoms of this include headaches occurring nearly every day, causing you to interrupt your sleep schedule, or improving only after using painkillers. And the most important problem with this phenomenon is that rebound headaches can cause you to take more and more medication, which leads to higher risk of overdose. Preventive measures include taking medication only as needed and resist taking it when the headache is at lower intensities. Also, stay hydrated, sleep more, and avoid any headache triggers. So now let's talk about some alternative treatments. Aromatherapy has been getting more common in the medical field. One thing to note, however, sniffing air fresheners, candles, or fancy perfumes is not aromatherapy. These smells come from herbs, and they consist of essential oil, which consists the essence of the herb. Pain relief from aromatherapy is not beneficial because of the smell, but because of the chemicals that passes through the nose and skin. When you come into contact with these oils, either applying topically or smelling them, these chemicals get absorbed into the bloodstream. The chemicals reach the limbic system, which consists of cranial nerves that deals with the expression of feelings and intuition. The essential oils decrease levels of cortisol, lowers the heart rate, suppresses pain, reduce inflammation, and improve anxiety and depression. Some oils to help with headaches include butterbur, peppermint, rosemary, lavender, chamomile, and eucalyptus. Acupuncture is a practice that consists of thread-like needles stimulating points within the body to release chemicals to the central nervous system. It usually uses 4 to 10 needles and leaves them in for 10 to 30 minutes. The whole therapy spans for 6 to 12 sessions. The needles relieve pain by releasing endorphins, which are the body's natural pain-killing chemicals, into the body. It also helps increase the production of serotonin, a chemical that can improve the mood one experiences. It eases low back pain, fibromyalgia, nerve pain, headaches, menstrual cramps, and more. Acupressure is like acupuncture, but it does not use needles. Instead, the specialist uses their fingers, hands, and palms to apply pressure at acupressure points throughout your body. The cool thing is you can learn to do it by yourself by learning the points of massage for maximum pain relief. These points are located near nerve fibers in your body, which carry messages from nerves throughout your nervous system. Acupressure intercepts messages regarding pain before it reaches the brain. By massaging these points, other messages can be relayed to reach the pain that codes for the production of endorphins and serotonin. The spot, L14, relieves headaches, and it is located in the web of skin between the thumb and the forefinger. PC6 relieves stomach aches or nausea and is located 2 inches above the wrist joint between the muscle tendons. LV3 relieves body pain and is located on the feet in the web between the big and second toes. Cupping therapy is a practice that involves placing suctioning cups on the skin, typically on the back. The suction allows for blood circulation to increase in the area, hence why the area appears red after use. It is also said to circulate qi within the body, which is Chinese for the energy of life force. The cups relieve pain, ease damaged tissue within muscle and skin, and reduce muscle knots. This relief is what people feel better from, and that there's a sense of relief flowing through the body. Cupping also minimizes toxins building up in the body by drawing them up to the top of the skin, after which the specialist cuts the skin to allow the contaminated blood to get out. Heat therapy involves increasing the temperature of the painful area of the skin. This can be done through 2 ways: dry heat, which comes in the form of heating pads and saunas, or wet heat, which comes in the form of hot baths and steam towels. Heat therapy works by improving circulation of blood. The increase in temperature soothes discomfort and increases flexibility of the muscles by relaxing them. It can also be used to soothe scar tissue and heal the damage. It relieves osteoarthritis, rheumatoid arthritis, back pain, fibromyalgia, neck pain, and muscle aches and spasms. Guided imagery uses words and images to promote health and healing. When we have pain, we often think about it all the time. However, that increases stress, and these thoughts cause the body to physically feel the presence of pain. These imagery can come in the form of words with positive connotations or visuals of the beach, sun, or rain. The practice promotes relaxation by taking your mind away from the pain, lower blood pressure, and reduces stress. The mind is incredibly powerful, and by using these images, it can cause the body to see the picture of a beach and actually experience that instead of the pain. There's a link in the description box below for an example of guided imagery. Clinical, clinical hypnotherapy is often used for phobias, anxiety, and suppressing addiction. However, it is effective in a pain management plan. It brings the patient to a hypnotic state, which is a state that involves a deeply focused pace of mind. Your thoughts go away, and you can place your attention on only one thing. The hypnotherapist will then use positive statements such as, relax. Your body will listen to your mind and physically compel itself to relax. This soothes the pain and controls it under the bay. Wave therapies. First, let's talk about cold laser therapy, a practice that uses low levels of light to focus it on a specific area. This stimulates healing. The layers do not warm the body like heat therapy does. It uses different wavelengths and applies it directly to the area. The body tissue absorbs the light and the cells respond with regeneration. The wavelengths used here are between 600 and 700 nanometers. This allows the to reduce inflammation, swelling, and pain on a cellular level. Ultrasound waves, or therapeutic ultrasound waves, are used to relieve pain, increase blood flow, and increase flexibility of tissue. It delivers a high frequency vibration to promote healing. There are 2 types, thermal and mechanical. Thermal UW delivers continuous vibrations which increases heat. The heat then relaxes the cells and reduces the pain in the area. Mechanical UW uses pulses of sound waves to reach deeper level tissues. This causes movement in the tiny gas bubbles of the skin to reduce pro-inflammatory mediators, chemicals that are involved with the pain process. TENS, or Transcutaneous Electrical Nerve Stimulation Unit, is a battery-operated machine that delivers electric pulses through electrodes. The electrodes are attached to the skin. The impulses interrupt the CNS, reduces its pain signals to the brain and the spine. The machine also stimulates the body to produce endorphins. Radiofrequency ablation, also known as rhizotomy, uses heat to reduce the transmission of pain signals in the CNS. The procedure, minimally invasive, delivers radio waves into the skin, which then soothes and relaxes the muscle and skin fibers. It treats the pain in the neck, back, knee, and pelvis. Massage therapy. Massage therapy, or getting massage, can help with muscle pain. Massages relax painful muscles, joints, and tendons. They do this by stimulating nerve fibers and intercepting pain messages released by neurotransmitters in the CNS. According to Harvard's article, Therapeutic Massage for Pain Relief, a study found that 60-minute therapeutic massage sessions, 2 or 3 times a week for 4 weeks, relieved chronic neck pain better than no massage or fewer or shorter massage sessions. Physical therapy. Physical therapists are able to help with pain management. By focusing on a specific area, patients experience less pain. This could be due to the fact that adrenaline flows through the body when doing exercise, and it masks the symptoms while it is in the body. Therapists also use manual therapy by mobilizing tissues through manipulation of the movement of the area. This is especially useful for carpal tunnel syndrome and low back pain. Chiropractic therapy. Chiropractors focus on the spine or the body alignment to relieve pain and improve function of the body since the spinal cord consists of many nerves. By therapeutically moving the spine in order to place pressure on vertebrae, the specialist can target a nerve and stimulate it to reduce the better expression of pain. Along with that, specialists can educate patients on their pain, giving them a better understanding. If you are someone who experiences chronic pain and had it for a long time, you may have to turn to medical marijuana for pain relief. Marijuana causes compounds such as THC, tetrahydrocannabinol, or CBD cannabidiol that may have a role in pain relieving chemicals. THC resembles cannabinoid chemicals in the body, which are receptors in the brain, and it can help people feel relief because the brain gets exposed to these soothing chemicals. THC causes an elevated state of mind called a high, but CBD doesn't. When using medical marijuana, it is greatly advised to talk to a doctor first before using it. Marijuana can be addicting and lead you to be drawn to higher intensity drugs. However, with a doctor's approval and support, it can also affect the function of your daily life. Meditation is when you clear your mind and focus on one thing specifically. Meditation shifts your focus to a quiet space, which takes your attention from the pain or triggering factors. When in this state, your body will not release stress hormone into the bloodstream. Muscles and tissues relax, and your body is calm, soothing yourself as it gives space for your brain to release endorphins. It increases your pain tolerance, lowers hypertension, and increases breathing and blood circulation. Research also shows that combining meditation and yoga was more effective than drugs and surgery. Even meditating for 20 minutes every day can reduce your chronic pain, so please try it out, as it can dramatically change your life and turn it for the better. Reiki is a traditional practice which deals with using energy to heal the body. Practitioners use palm healing or hands-on healing, which transfers energy between the practitioner and the patient. Reiki changes how the mind perceives pain. Pain causes anguish, and by clearing up that anguish, the patient feels lighter, as if the burden is off. This results in relaxation, reduced pain, and tension in the body. Psychotherapy, or cognitive behavioral treatment. Other than physical treatment of pain, one also needs to treat the psychological roots as well. It comes from anxiety and other mental illness treatments, but it can be used to calm the mind when in pain. CBT pushes patients to face their pain firsthand and transforms their beliefs when it's too negative. For many, the pressure of having pain can affect their mind's stability. Spirituality can really help in this scenario. Even if the body feels good, the spirit may be affected or damaged. For example, a heart transplant patient, after a very long time of waiting for a new heart and experiencing pain, can finally get a heart. But afterwards, the risk of them rejecting it is very great, as even though their body is safe and healthy, their spirit is not ready to accept this new change in life. A faith intervention can help patients put their trust in something greater than science, which can help them feel more ready to face this pain. This spiritual coping can also help patients reduce their intensity of the pain in the future. We may use all of the medication in the world to fix the body up until it's almost brand new, but the spirit must be willing in order for the mind to fully understand the pain and live with it in a happy, healthy way. As we covered in this presentation, pain is something we all have to deal with on a daily basis. Pain can be difficult, but educating yourself in different pain methods can change how you may perceive struggles in the future. Many people know about the tiny bottles of pills that make it seem like magic, but the real magic is in having a deep relationship with your body to be comfortable with it. The body is important, but the mind is strong. Changing how the mind sees things in life can affect how it sees pain and decrease certain symptoms. Please learn more about your options because there may be a treatment that works better for you than medication. Every single body is different, so exploring more about the different parts of your body can turn that frown to a smile. So take a deep breath and live free. These are my references. Please do not hesitate in learning more information. And thank you for listening to my presentation. Please stay safe, happy, and healthy. And I hope you take these new lessons and put it in your mind to form yourself a stable and pain-free way of living. I wish you all the best, and I hope that you are compelled to learn more about your body and mind through this presentation. Have a nice day!